So glad of you to join us today. We're very excited to have our second presentation of the Pilot Grants Program series for this year, and to have Sara DeCoteau here to present their pregnancy health survey for parents of newborns on the Lake Traverse Reservation. So just to do a little introduction of Sara, is the Health Services Coordinator from Sisseton and Wahpeton Oyate, and has worked in tribal health for 40 years. And those of us who've been the privilege, yes, amazing, the privilege of working with her over the years. I mean, she's so well known across the region for all the great work she does in Native health. She was awarded a Bachelor of Arts in Human Services and their management from the University of Minnesota Morris, as we have other alumni from here. Sara has represented the Great Plains area and tribe on regional and national work groups and collaborated on a number of research projects implemented on the Lake Traverse Reservation. Currently, Sara is serving as the principal investigator of 2 studies, not just this CRCAIH pilot grant, but also an EPI-AIDS collaboration with the Centers for Disease Control and Prevention, Substance Use During Pregnancy among American Indian Mothers, which is something many of us in the room are also looking at. She serves as a member of the SWO Local Research Review Board and is interested in efforts to develop SWO's capacity to collect and manage its data to improve programming. So things CRCAIH is very, very interested in supporting. So without any further ado, please help me welcome Sara DeCoteau.
Good morning, everyone. I'm excited today to be able to present the results of our pilot study that we started in 2015. I want to first of all acknowledge and thank CRCAIH for funding this project and for providing all of the great technical assistance, and also our partners at South Dakota State University. Dr. Bonnie Specker was the co-principal investigator for this project. For Sisseton Wahpeton Oyate, Dr. Sherry Johnson was a co-investigator. Teresa and Tiana are at SDSU, and Audrey is our community health education program manager. So they were all leaders in this study. Peggy Peters and Maggie Manette did a lot of the actual work on the survey. Whoops. It'll take me a little while not to hold it down too hard. So the purpose of our study were 3 things. One was we wanted to conduct a survey to find out why some babies are born healthier than others. I think we all know that a big health disparity that occurs in South Dakota is infant mortality. The infant mortality rate, 5-year average for an American Indian infant is 12.2. And for the white population, it's 5.1. So why is that? That was one of the things that we were interested in learning. We also wanted to find out about fathers. We wanted to know about what's happening with fathers during the pregnancy and how they contribute to the health outcomes of their babies. And to use the information that we collected to improve health services for people. So that's what we were interested in doing. The aims of the project were to use the Centers for Disease Control's instrument, PRAMS. So how many of you are familiar with PRAMS, the Pregnancy Risk Assessment Measurement System? Everyone is. So we wanted to use that method and then to adapt the PRAMS tool for use with fathers. Thirdly, we were interested in obtaining Sisseton Wahpeton specific information about adverse childhood experiences, and we were interested in how those adverse childhood experiences affect the behavior of the mothers and the fathers during pregnancy, and whether that is associated with outcomes of pregnancy. A little about our methods. We surveyed mothers and fathers of infants born between April the 1st and December the 31st of 2015. They were for the South Dakota counties for our reservation, Roberts, Day, Marshall, and Cottington counties. Some babies are born in North Dakota, at the facility there. But so long as their residence was South Dakota, we were able to survey them. One of the things we did find out is that those birth certificates, when a baby is born in North Dakota, go to Bismarck. So that required some extra footwork. We knew that we had about 158 births per year, so that was starting out what our plan was. So the births were identified from birth certificate data that was downloaded in collaboration with the North Dakota and South Dakota Departments of Health. The downloads went to South Dakota State University. The moms and dads were invited to take the survey when the baby was about 2 months of age, as in the PRAMS protocol. South Dakota State University sent out a pre-letter, and the pre-letter invited the mothers and the fathers to take the survey online. If they didn't take the survey out online, then the survey booklet was mailed out to them. Each parent was given their own unique identifier number. That way, we even though they were getting booklets and they were getting letters and they were being invited to do it online, we wouldn't duplicate. We outreached, so at the local level, we outreached to the community to get people, so that people knew that after they had given birth, that they would be invited to participate in the survey. This is one of our flyers that we circulated. We also had it in the paper. The surveys, once they were completed, were sent directly to South Dakota State University, where the data was kept secure. So the envelopes, the mailing that came out with the survey booklets had a self-addressed stamped envelope in it. The online version, the survey results went directly to SDSU. The data were double entered and analyzed at SDSU, and the statistical results that came out of it belong to the Sistine Wahpeton Oyate and cannot be shared without permission. This time I want to acknowledge our Sistine Wahpeton Oyate research office and local research review board, who approved this presentation for you all today. Our responses were good. We achieved our goal of 60% and higher for mothers. So we had a 62% response rate for mothers. 92 responded. This was the first time ever that fathers were surveyed. And so we're pleased that we got the 51% response rate. We had 64 fathers complete the survey. We had 149 births in our sample, more than we expected to have, because this was 9 months instead of a year, and 62 mother-father pairs completed the survey. We wanted to do correlations between moms and dads, so we had 62 pairs to look at. And we found out that SWO parents are making many positive choices. One is smoking cessation. When mothers find out that they're pregnant or during the pregnancy, 48% were quit. 91% of the mothers and 97% of the fathers say that no smoking is allowed anywhere inside of their home. 88% of the mothers and the fathers agree that there's no smoking in the same room or vehicle with their baby. Among the mothers who said that they'd used alcohol in the past 2 years, 84% did not drink during the last trimester, and 74% of our mothers breastfed. 34% were still breastfeeding when we surveyed them at 2 months and longer after the birth. We had great responses from the fathers. So dads were present for the baby's birth 88% of the time. And when they weren't there, the reasons included lack of child care or transportation, or they couldn't get time off from work. The majority, 53%, also took time off from work after their baby was born. And again, for those that didn't take time off from work, it was because they had to work or they felt that mom had enough help without them. 70% of our fathers were very supportive of their baby's mother's decision to breastfeed. And what's significant is that when dads were positive about breastfeeding, the moms were more likely to breastfeed. So for fathers who said, I'm supportive, 91% of the mothers breastfed. And for fathers who said breastfeeding is better for baby, 92% of the mothers breastfed. Also, we learned that most dads are attending the well baby appointments. 73% are attending. And of those 73%, 34% are attending all, about a third of them are attending all of the well baby appointments. The third thing that we wanted to learn about was adverse childhood experiences and how that's affecting maternal behaviors and maternal outcomes. And what we did find from the study is that the adverse childhood experience scores, the higher scores, correlate with alcohol use in mothers. It correlates with illicit drug use in mothers and fathers, and it correlates with depression in both mothers and fathers. So how many of you have heard of the adverse childhood experience study? Okay, we've got about a third of the people in the room raising their hand. So just to explain it a little bit, there was a big study that Kaiser Permanente did in California, and it was a longitudinal study with over 17,000 people, and they found that strong, frequent, prolonged exposure to adverse childhood experiences over time with no adult support to mitigate the stress caused by the adverse childhood experiences results in toxic stress. So the adverse childhood experience results it actually affects how the brain is developed. The brain is wired differently because of the exposure to the toxic stress, resulting in social, emotional, and cognitive impairment, maladaptive behavior, disease, disability, and social problems, and premature death. So, and that is transmitted intergenerationally with the behaviors, and we're going to look at some of this. This information is sort of heavy. The people who are conducting the adverse childhood experiences are saying, or adverse childhood experience study are saying, is that ACEs are the number one health threat, public health threat of our time, and that we need more effort to try to eradicate this so that a generation from now we can tell our grandchildren this was a big problem, back years ago, but we've now come up with methods to address it. So here are some of the things that we learned. We learned that so there's 10 adverse childhood experiences that the study has come up with, and this first section has to do with abuse and neglect. We learned that SWO mothers were more likely to experience physical and emotional abuse before their 19th birthday than fathers, South Dakota American Indian mothers, or South Dakota white mothers. Nearly 2 out of 5 SWO mothers have been emotionally abused, and nearly 1 in 4 SWO mothers and South Dakota American Indian mothers have been sexually abused before their 19th birthday, according to what we're comparing this to is the 2014 PRAMS data that was completed. The second category of ACEs are household dysfunction, and we learned that the most frequent types of household dysfunction that our young parents are experiencing are divorce and separation, and household alcohol and drug use. Over 1 in 4 SWO fathers and SWO mothers experienced having a household member incarcerated before their 19th birthday. It's a startling statistic. It wasn't something that we expected to find, but that was one of the big findings. Now I'm going to talk about other stressful events. Some of these are adverse childhood experiences, but now I want you to think about the infant. So the history on our study came out of our first 1,000 Days initiative. We have a group that is working on trying to prevent adverse childhood experiences and trying to mitigate toxic stress. So we're interested in trying to prevent this during the birth year. So the next few slides have to do not with adverse childhood experiences that the mothers and the fathers experienced, but what the new babies are experiencing. The most common stressors during the 12 months before pregnancy and since birth were having someone close to the mother having a problem with drinking, moving to a new address, arguments more than usual with their partners, and having someone very close pass away. 4 out of 10 mothers had someone very close who had a drinking or drug problem during the birth year, and 3 out of 10 did since the birth. So having a household member with an alcohol and drug problem is one of the adverse childhood experiences. This means that the newborn baby already has one adverse childhood experience. Another adverse childhood experience is having a household member that's incarcerated. And this was startling to find out that 23% of SWO mothers said that either they or their husband or partner went to jail during the birth year. And when we surveyed the mothers somewhere between 2 and 6 months after the baby was born, 11% said that had happened since the birth of their baby. 21% of the SWO fathers had experienced this before birth, and these rates were higher than for divorce and separation. Divorce is an adverse childhood experience, and more than 1/4 of SWO mothers separated or went through a divorce during the birth year or since the birth. Stressful events. So you can, in looking at the little bars, you can see that the bottom part is statewide, and then we've got SWO mothers since the birth, SWO mothers after the birth, and then SWO fathers before the birth. It all had to do with the questions. And in looking at this, what we found is that the stressful events during the year before the birth occurred more frequently for SWO mothers and fathers compared to the 2014 PRAMS Life Survey. So our young parents are experiencing a lot of stress during the birth year. Not only high adverse childhood experiences, but also a lot of other stress. 14% were homeless. There was a lot of poverty. 3 out of 4, or 75% of the mothers, had household incomes below the federal poverty level, and 72% of the fathers. Half the SWO mothers stated the annual income during the birth year was less than $10,000. Intimate partner abuse, and we're not talking about violence. We're talking about abuse. About 1 in 10 SWO mothers, and also about 1 in 10 SWO fathers, about the same amount reported abuse. For the mothers, what they talked about was controlling behavior on the part of their partner. And for the fathers, the most common abusive behaviors during pregnancy were criticizing, name-calling, and shouting, harassment, and regularly threatening to leave or make their partner leave. The most common abusive behavior that SWO fathers experienced before pregnancy was withholding approval. SWO fathers reported less abusive behavior after the birth. So during the pregnancy, there seems to be more tension, more stress that's being experienced during at that critical time. So talking, we're going to share some of the results of the ACEs scores, but I want to explain it a little bit. So with we know there's a stair step or cumulative effect. The more ACEs you have, the higher your risk is for all of these. First of all, sedentary lifestyle, smoking, alcoholism, drug use, and missed work. The physical and mental health, things like severe obesity, diabetes, depression, suicide, STDs, heart disease, cancer, stroke, COPD, broken bones. It's all a stair-step effect. If you have four or more ACEs, you're more likely to have these things. And this pie chart shows from the study that was done by Kaiser Permanente how likely people are to have 1 ACEs, 2 ACEs, 3 ACEs, and so forth. So this is the findings from our study. The blue bar is South Dakota white from the 2014 PRAMS-like study that the South Dakota Department of Health did. The I guess you would call that pink one is South Dakota American Indian, also from the 2014 PRAMS study. The green is SWO mothers, and the gold is SWO fathers. So fewer SWO mothers and fathers had ACE scores of 0 than South Dakota white mothers. In the ACEs study, 36% had ACE score of 0. ACE scores for categories 1 and 2 were comparable between the populations with the ACEs study. So beginning with 3 or higher, the differences emerge. 17% of the SWO mothers had a score of 3 compared to 9% of the South Dakota American Indian mothers, 6% of the South Dakota white mothers, and 10% in the ACEs study for women. 11% of the SWO fathers had a score of 3. For similar to the ACEs study, so in the ACEs study, 12% of the females had a score of 4 or higher. This was similar to the South Dakota white mothers, where there were 13. However, for the South Dakota American Indians, SWO mothers and SWO fathers, the scores were about 3 times higher. And here's where we looked at some correlations. One of our goals, one of our aims was to see if there was a correlation between ACE scores and behaviors. We found that SWO mothers with higher ACE scores were more likely to have used alcohol and to have used illegal drugs in the last 2 years than mothers with lower ACE scores. That was true for fathers for illicit drugs. We didn't find the correlation in this sample for tobacco use. And the other thing was depression. So 21% of the mothers and 11% of the fathers screened in the pregnancy health surveys screened positive for depression. But with the higher ACE score of 4, 32% of the mothers had depression compared to when they had a score of 0 or 1. The fathers, the other significant thing is that the fathers, when they looked at, did the fathers think mom was depressed? Fathers, about half of the time, the fathers didn't even realize that mom was depressed. So that's concerning. We did, with our study, our pilot study, we didn't find a correlation between depression and either intendedness of pregnancy or breastfeeding, although this relationship has been found in other studies. So some ideas for improving services, and I'm just going to introduce them right now, and then we'll get into more detail. One is to expand behavioral health services to address this depression and alcohol and substance abuse issues. The second is community education. For example, on the importance of preconception nutrition. We know that 23% of the mothers took folic acid prior to the pregnancy, and 1 in 3 mothers knew why it was important. But there's room for improvement with that. Another example for community education is safe sleep. 28% said that the babies never or rarely slept with the parents, slept in the same bed, but there's still 72% where there is co-sleeping. And probably most exciting is the opportunity to serve dads. So 32% of the dads are coming to prenatal appointments. And of those 32%, that's about 1 in 3, over half of them are attending at least half of the visits. 47% of the dads expressed that they were very anxious about the delivery. And so that's an opportunity to work with the dads. We did use the data from the study to apply for a SAMHSA grant. It was called Intendedness Project Launch. We know that 21% of the mothers and 6% of the fathers said that they were checked and treated for depression or anxiety during the year prior to pregnancy. And what we wanted to accomplish with this launch grant, had it been funded, would be to work intensively with the mothers who are depressed, because that depression is related to a lot of other things. It's related to their own adverse childhood experiences. It's embedded in their own histories, and the issue of maternal depression is compounded if dad is depressed, if grandparents are depressed, if other caregivers are depressed. And the reason for it is that when people are depressed, they're less likely to interact positively with children, give them attention, nurture them. And we felt that that would be a real good place to start. Unfortunately, even though we spent hundreds of hours on that application, SAMHSA withdrew the FOIA last month. So the application went in February, and we received word last month that they withdrew it. But we do hope to recycle the ideas. So talking a little bit more about community education on the importance of preconception nutrition. This shows that this little gray area here, that's how many people were taking a multivitamin with folic acid prior to pregnancy. I thought that was a pretty good number, but our SWO mothers are less likely to taking the multivitamin with folic acid than other populations. And more importantly, they don't know why. And I'm sure they're told, but they're not being told in a way that they're retaining it or that they're understanding it. So less than 1 in 3 mothers understood the reason for taking folic acid. We're doing a very good job. Our parents are doing a very good job with putting babies on their backs to sleep. But with safe sleep, about 1 in 10 SWO babies do not co-sleep. And the danger in not having that be a regular pattern and habit is that the baby can be smothered by the parent or wrapped up in the bedding, or somehow or other get pushed or fall off the bed. And we have had babies get pushed off onto like the heat registers or sometimes between the bed and so forth. Also, another opportunity for intervention is with addressing obesity. So 54% of our SW mothers were overweight or obese, and 90% of our SWO fathers were overweight or obese. Fathers are coming into clinic. There's an opportunity to take their blood pressure, get their histories, and start working with them. Intendedness of pregnancy, 9% of our pregnancies were not intended, and the moms and dads agreed that they weren't intended. The main reason for not preventing pregnancy was that the moms and dads didn't mind if there was a pregnancy, and they were happy about it. The survey asked them how they felt, and they indicated that they were happy about the pregnancy, but still there is a lot of stress. We noticed, we talked about the domestic abuse already that's occurring. The stress in the household is causing more fighting. Another opportunity is with substance use disorder treatment. Although the questions about illicit drug use during pregnancy were not in the survey, the parents were asked about use during the 3 months prior to pregnancy, and we were interested in the results. So marijuana was the substance that was most being used, followed by non-prescribed prescription drugs and methamphetamines. And you can see the breakdown there for the mothers and the fathers, and compared with South Dakota American Indian and South Dakota White from the 2014 PRAM study. 1 in 3 SWO mothers indicated that they'd used marijuana during the 3 months before pregnancy. That was the question that they were asked. 1 in 8 had used non-prescribed prescriptions such as opioids. 7.9% of SWO mothers and 4% of SWO fathers reported using methamphetamines. This is a lot lower number than what the perception is in the community. The community has a perception that it's a much higher rate than this, and it's actually lower. We're also interested in polydrug use. Are there some combinations of drugs that moms and dads are using together? And the most common ones were marijuana and opioids, and marijuana, opioids, and meth. SWO mothers were more likely to report using marijuana, opioids, and methamphetamine than the fathers, and also the South Dakota American Indian mothers and South Dakota white mothers. So I want to stress that most of our mothers and fathers are non-users. They're not using drugs. So I want to stress that. But of the ones that are using, marijuana is the main thing, and then others. Here's where the opioids and meth. And also, I think it's significant to note that 9% of the mothers said that they received help for an alcohol or drug problem during the pregnancy, and 10% said they'd received help since the baby was born. So that's significant that they are accessing services. Opportunities to serve SWO fathers. We were very interested that 4 out of 5 fathers stated that they were somewhat or completely anxious about the delivery. And we checked to find out whether there was a correlation between that anxiety and adverse childhood experiences. There was not. So there's opportunities to serve dads. Could the dads be navigated into appointments for dental cleanings? So when you look at this, the dads are this green bar, and notice that all the way along, they're the least served of anyone, and yet they're coming in for well baby appointments. They're coming in with their babies or their mothers when she's coming in for prenatal appointments, and they're not getting services. And look at the hygienes. The hygiene services are very, very small. Only 19% compared to what the mothers are getting. And because of the obesity, the dads could be checked for obesity. We could be checking their blood pressure. So that's a huge area for opportunity. And this was a pilot study, and so part of it we knew we weren't going to be that this wasn't a high-level randomized clinical trial, but it was to get an idea, some future areas of things that we could work on. And one is that this survey, the survey instrument, the PRAMS, is based on, it's geared to finding risks. And it's not a strength-based type of survey. We're not looking. We can flip the responses to look for the positive side of things, because the glass is either it's half full or half empty, but it isn't a strength-based type of survey. And we'd like to do more of that in the future and study resilience, because I think we know that American Indian people are the most resilient people on the planet, and there's a lot of things that we can learn from them. So despite the adverse childhood experiences and all of the stresses, we have parents who are having good birth outcomes. We'd be, I think, doing a lot more work with the dads to find out maybe some qualitative surveys to find out about this extreme anxiety that they're experiencing, and how that might be affecting their behavior. Remember, during we talked about domestic abuse is what it's called. We have controlling behavior. So we got dads that they're worried about the delivery. They're trying to control as much as they can, or to influence that. And maybe moms are reacting to that controlling behavior by being more creating more discord in the home. All of that contributes to the stress. So that might be an area for future research. And as I mentioned, the depression, working with the depression that's occurring with the mothers is also an area that we're interested in. And that concludes my presentation. Thank you very much.